For my project, I did drug addiction. In my unit 8, we talked about how drug treatment options need to be restructured. If we keep going with the drug treatment options that we already have, we're not going to see much of a success rate. I have added a chart here about drug overdoses. It goes by years from 1968 to 2016. And since the year I was born, 1990, drug overdoses have risen highly. And basically, estimatedly, the 650% area, it has raised from the year 1990. After my brother was born, people started using heroin because it was easier to grab than having to go see a doctor and describe your pain and stuff and hope that they give you a prescription for opiates. Heroin in the young generation of whites has been increasing since before 2011 because switching from opiates wasn't just about easy access to young whites, but it was more of a reason to be less expensive for them. Heroin was less expensive to access. And here's the chart that goes with this paragraph. This is non-Hispanic whites, and this is non-Hispanic blacks. I did a comparison chart, which I found online, and that will be, the reference will be in my summary of what I'm going to write about this. As you can see, the percentage of non-Hispanic whites heroin admissions rise. Basically, between like the 20 and 30 age, it rise. Whereas for non-Hispanic blacks, it mainly stayed pretty low. This is a chart I decided to pick because a lot of people following overdoses and stuff end up in the hospital because of drug-related issues. For pharmaceuticals, for the blue one, it was like basically like between 250 and 300. The 400 and 450 is purple. This drug, I can't pronounce the name, is between the 350 and 400 and then drops a little bit in the purple. For underage drinking, it goes down, and alcohol, and then drug and alcohol go down. The main one is pharmaceutical drugs, because everybody goes to the doctors to get high. And if they can't get it, they end up switching to heroin. Heroin is a big problem. I believe that drug addiction has been an epidemic in my community because I see it happen a lot. Mainly in the young kids, like kids that used to grow up with my brother and he don't hang out with no more because of how their life is going. And not only is it in my community, it expands outside the community as well. See, compulsion can trap anybody. Once you put a drug in your system, whether it's for pain or you're sick at the moment, like your brain takes those signals, and sometimes for certain people, their body gets used to the drug, so they think the drug's not working and they pop more in them, like 2, 3, 4, whatever. And by the time you realize it, your body's addicted to drugs. This is why it's considered a disease and not a choice, because it's your body that immunes to it, to where it makes some people want to take more and then they can't stop using. This addiction can cause issues between family bonds and add to the delinquency in our local community. We already have a delinquency problem, but drugs make it worse. The sooner individuals get real help, the better chance they have at a recovery and a healthy life. This brings me to drug treatment options that have failed because we substitute one drug for another. And I know people that have taken methadone and are still on it and are trying to get off of it, but their doctor's like, oh, you're not ready. And they've been clean for years and they don't even think about the drug. They don't even want to be near people that have the drug. They just want to be off the methadone because they feel like it's a substitute for the drug and they want to just be done with drugs, period. I've talked to a few people about it, and their biggest thing is that sometimes after completion of program, group, or rehab, like being away for 30 days, 90 days, whatever long they go, depending on how bad they are when they first seek treatment, after they're sent back into the real world and home, they say that nobody checks up on them. They don't have help after completion of their program or rehab. They don't have guidance, and sometimes triggers, like some people have depression and social anxiety, and that leads to some people's addictions. And if they start feeling that depression or social anxiety or stress and they don't have help after program, they don't know where to turn. They end up going back to what they know, what helped them, forget, ease the pain. We need to come up with a after program treatment plan where you have guidance for 5 years, 6 years, or 12 years, depending on how bad people are. Because some people, like people that take heroin shoot like 50 bags a day. They're going to need more help than somebody just taking a few opiates or whatever. So we should be giving them an at-home plan for when they go home. And this plan consists of a sponsor or a mentor, which they should have during program and rehab, but they should also leave with that same sponsor or mentor, or a different one that calls them like every once in a while, checks on them, guides them, helps them to find a job, helps them if they want to go back to school, since, some of them probably lost their job due to their addiction. If people don't want to go back to the same environment they were, help them find a halfway house or, somewhere where they'll be out of that kind of environment. Like, for a few years. Check on them for a few years, and once their to-go plan is over, like the 5 years are up, and if they're still clean, okay. You don't need to check on them anymore. But check on them when the first few years after completion. I feel like if we check on these addicts and we show them that we care and we're still going to be there after completion and we're just not, detoxing them and throwing them back into the world and saying, you're all by yourself now. Like, we can get them back on the right track. Because I've helped somebody recently with his drug addiction, and I'm still there. Like, he just graduated program, and I'm still there helping him. And he told me that if it wasn't for me, he would have never got clean. Like, I was his constant, always pushing him to be better. He has a job now. He's doing good. He's trying to get his CDL. he was going to talk on my presentation, but he's at a graduation dinner for his brother. If I can, I'll get his reaction video later and send it in as the second part of my project if it's okay. But yeah. Also, this area I picked from my paper that individuals have been debating for years if drug addiction is a disease or choice. Even though physicians and experts have agreed that it's a disease and proved that there are psychological factors that take part once your body and brain receive medication for pain, which was in my paper. I was like, still, some till this day will debate this. They will believe it's a choice. They say it's a choice because only some people become addicts and not everybody. But that doesn't mean that it's a choice, because that would be saying like, oh, some people that have diabetes and some people that don't, means those people that have diabetes don't really have diabetes. It's all in their head. It's a disease. So it's a condition. So like any other condition, everybody's body is different. Everybody's body reacts different. So some people's bodies are going to get addicted to drugs and immune to the drug, where they take it so much that they become addicted, where other people are going to, take one medication for the pain and it's going to work, and they only take it for as long as the label says and then they're done. Some people are strong enough, to not become addicts, but some people aren't. And I found that it's mainly in the people that are weak. Like the people that have social problems, depression, stuff like that. It's easier for their brain to send different signals to their body. So to me personally, I believe it's a disease. I'm always going to believe it's a disease. And I want to change this. And I hope that we can change this in the future. And I really hope that my project shows you everything that I did. Like, I took these charts from the website. I'm gonna put each chart's reference on my paper thing that's gonna go in with my video. And I hope that you guys understand how bad drug addiction is, and that we need to make a change fast, and maybe we'll have better rates. Maybe these rates won't be so high. They'll become low.